He had his primary surgery done, I think 9 months ago. 6, 7 months back. Okay. உங்களுக்கு ரிவிஷன் பண்ணியிருந்தில்ல?
எஸ் சார்.
ஃபர்ஸ்ட் சர்ஜரி எங்கே பண்ணீங்க? ஈரோடில்.
ஆமாம் சார்.
So we're doing the splint removal for this patient. So this is a revision rhinoplasty. This is a very, very challenging one. He had his primary surgery done, I think 9 months ago. 6, 7 months back. Okay. And this was very, very challenging because there were a lot of issues that was not right from the earlier surgery. I'm going to go through that in a while. But first, let's just clean up his nose and the splint. இது கொண்டு வா, கொஞ்சம் படத்தை கொண்டு வா. ஃபினிஷ் காட்டு, இங்கே கொண்டு வா. நேராக பாருங்க, நீங்கள் பார்க்கலாம். கண்ணாடியில் பாருங்க, திருப்பணும். All right, so you can see this. His tip was totally deviated. It was protruding. It was like an elephant's trunk, I could say. And there was a lot of cartilage in the wrong places. There was a big bump. The nose was not proportional. And you can see the improvement. I had told him that we're going to get him 90% or 80% thereabouts. I think it's pretty much there. It's better than that. ஏன்னா இந்த டிப் வந்து நல்லா வந்திருக்கு உங்களுக்கு. இட்ஸ் நாட் பல்பஸ். இது ஆங்கிள் கரெக்டாக இருக்குது. இது பார்த்தீங்கன்னா யூ சி த ஷேப், இட்ஸ் நாட் விசிபிள். திஸ் இஸ் நாட் ப்ரொட்ரூசிவ். ஒன்லி திங், this point is not very pointy, but much better than before. Okay, இதெல்லாம் நல்லா வந்திருக்கு. I've given you a nice shape here. Okay, narrow ஆயிருக்கு பாருங்க. அது எப்படி இருக்குது, இது எப்படி இருக்குன்னு வித்தியாசம். All right, we show you the side views also. இப்படி பாருங்க எப்படி இருக்குன்னு. சூப்பர் டிஃப்ரென்ஸ். பக்கத்தில் வாங்க. கரெக்டா ஸ்ட்ரைட்டாக இருக்குது. இது வந்து நடுவில் ஒரு இது மாதிரி இருக்குது, ஒரு பல்பஸ் திங் இருந்து ஃபுல்லாகவே. சைடில் எப்படி தெரியுது பாருங்க. Can you see that? Now it's not visible. Correct? These are all important things. Seriya? In the revision rhinoplasty, it's very hard. Pakkathula kondu konjam. Eppadi? So you can see the difference, I think. I mean, this is what we call as the columellar show, and the relation between the ala and the columella and the tip. And this is how it should be. You know, you got a little bit show, then the tip is right there. Nice angle here, about 95 degrees. And this is like way inwards. I've corrected that. There was a bulbous tip, a huge bulbous tip. We've corrected that as well. All right. Now we're going to look up, and I'm going to show you the asymmetry that has been corrected. Look at that asymmetry. And this tip was there. There was another tip here, and there was like a broad area with asymmetry. Now look at that. Tip is in the center, reasonably narrow. I'm not going to say it's very, very narrow. It's much reasonably narrow. Sorry, just a little bit. So we just took off the splints now, so that's why there's a small drop of blood that's coming there. Okay, now we're going to move on. Varka, that's it. All right, so once more, you can have the front look. And it's going to get only better. Okay? Right, so கொஞ்சம் குறையும். எல்லா இடமும் கொஞ்சம் ஸ்வெல்லிங் கம்மியாகும். ஏன்னா நமக்கு வந்து ஃபுல் ஸ்வெல்லிங் இருக்குது பார்த்தீங்களா, இங்கே கூட கம்மியாகும். இப்போ தானே எடுத்துருக்கிறோம், ஸ்பிளிண்ட் கம்மியாகும், நல்லாவே கம்மியாகும். நீங்கள் திருப்பி வாங்க ஒரு மாதம் கழிச்சு. So friends, there's one important take-home message for all patients that seek revision rhinoplasties. First thing, I like you to wait for 6 to 9 months. 6 months is the minimum time. Second thing, please understand a revision or a redo rhinoplasty, if it's a secondary one or a tertiary one or a quaternary one, are always more challenging, more difficult than a primary one. I handle lots of noses, lots of revision procedures. I tell my patients first up that look, I can only give you this much of improvement, especially when it's a revision. Now, in this particular case, I did tell him I'm going to give you probably 80 to 90%. And honestly, as I see him now, I think the improvement is much more than what I suggested or promised him. That does happen too. So this is the aspect. Why is it so difficult? Because revision rhinoplasties, you not only have to correct the mistakes or the incorrect procedures done by the earlier surgeons, you also have to keep in mind the patient's desires or concerns plus the original anatomy. So it's really tackling too many things at the same go, at the same time. And of course, there's a lot of scarring. Vasculature is not the best. It's not that easily moldable. And so then the difficulties are there. So anyways, it's just for you to understand that we do handle a lot of revision rhinoplasties. I've been consulting a lot of patients. Some of them are upset because we're not able to take them earlier on. But please understand that 6 months is the minimum waiting time I recommend. A little longer is always better. But then if we say we can improve, very often you can get results like this. There's another side to revision rhinoplasty, especially for a person like this, is the healing time. I've seen it takes a little bit longer. Now, usually I remove splints on day 7, day 8. We've kept it for day 10 for him. And you can see there's still a small dot of blood coming in, which just kind of indicates that the healing is a little bit more delayed. The final healing also is going to take time for him. It's not going to be happening in 4 weeks for sure. You've got to add 2 weeks, maybe even a month to it. And then the eventual total healing is also probably going to be 9 months, not 6. So all these things you can keep in mind. And yes, I keep telling this, face is the chief seat of beauty and nose is right in the middle of it all. Thank you. Bye.